Welcome everyone to Hawthorn University's webinar series. My name is Paula Bartholomew. I'm the school director here at Hawthorn, and I'll be the moderator for tonight's webinar. I want to welcome you all. We've got Hawthorn faculty and students, and all of you who are fans at Hawthorn and interested in holistic health and nutrition. Thank you all for attending. Our topic for this webinar is adrenal fatigue. It's the 21st century stress syndrome, and our guest presenter is Dr. Nikolas Hedberg. This webinar is an important topic, and it really addresses the issue of stress and the impact that it has on health and the role that the adrenal glands perform. So you'll be learning about health conditions that arise when the adrenals are fatigued and the physiological signs of adrenal stress, and most importantly, how to support adrenal health. It's really a pleasure to have Dr. Hedberg back with us for another presentation. Dr. Hedberg is board-certified chiropractic internist specializing in thyroid disorders, Lyme, and autoimmune diseases. He's the author of the book, The Thyroid Alternative, and teaches advanced functional medicine courses, and his practice is in Asheville, North Carolina. Welcome, Dr. Hedberg. It's so glad to have you with us.
Hi, Paula. Thanks for having me again.
Absolutely. So we are ready for you and your presentation when you are.
All right. So adrenal fatigue is a major topic, as you see in the title, the 21st century, because we're under more stress than we've ever been under in our history. We have all these external negative influences on our stress physiology, electromagnetic radiation from cell phones and computers. We have more toxins in our environment than we've ever had before. Approximately 100,000 toxic chemicals in commercial use today, and none of them have been tested on the safety of humans or the unborn. We work more than we've ever worked before. Our nutrition is not what it used to be. Our food is depleted, it's hollow, doesn't have the nutrients that it used to have. So you have all these influences on our bodies that are causing stress, and these modern day lifestyles, eating really fast, lack of exercise, carbohydrates to fulfill emotional imbalances. So our adrenals are just basically hammered day in and day out, and pretty much, you know, every chronically ill patient that I see usually has some kind of adrenal dysfunction. So if it's someone with gut issues or thyroid, fibromyalgia, Lyme disease, arthritis, you name it, there's usually some kind of adrenal gland dysfunction. And it can either be a major contributing factor to the symptoms, or it can be just one piece of the pie related to symptoms. So these are the main symptoms that you should be aware of. If you think you have adrenal dysfunction, things to look for. Fatigue is the first one, weight gain, depression, insomnia, salt and sugar cravings, osteoporosis. People who tend to urinate a lot at night tend to have adrenal dysfunction, mood swings, low sex drive, ulcers. If the adrenals are in hyperdrive, this will eat away at the lining of the stomach. Feeling shaky or lightheaded, hemorrhoids. You also might find that you get sick often, lots of colds and flus, so your immune system is compromised. And then the adrenals are intricately connected with the thyroid, so you're going to have low thyroid symptoms, cold intolerance, constipation, inability to lose weight, dry skin, dry brittle nails and hair. The other symptoms related to low thyroid cross over with adrenals, like fatigue and weight gain and depression. Hot flashes, dizziness, if you're moving from a seated to a standing position quickly and you get dizzy, that can be an adrenal problem. Low blood pressure, usually it's normal for it to be low in an athlete, but it's really not normal for your blood pressure to be very low if you're not an athlete. Increased allergies, blurry vision, varicose veins, and being a slow starter in the morning. These are really the main ones that you'll see in someone who has some kind of adrenal dysfunction. Many things can cause imbalances in your stress physiology and your adrenal glands. Number one on the list is food allergies. In this day and age, we're really looking at gluten, dairy, corn, eggs, and soy. Those are really the big five. Those can certainly stress your body. If you're eating the same things all the time, same things for breakfast, etc., you'll eventually stress out your immune system and the adrenals. Chronic infections, viruses like herpes or Epstein-Barr virus, Lyme disease, bacterial infections, and these can be in the mouth, like if you have bleeding gums, poor dental hygiene, fungi, parasites, anemia, and this can be any type of anemia. It doesn't matter what it is. It could be an iron deficiency anemia, B12 anemia, dehydrated, not drinking enough water, toxicity, metals, environmental toxins. And then if you've had some kind of traumatic event in your life, death of a loved one, traumatic accident, divorce, things like that, these can sometimes permanently cause some disruption in your stress physiology. Electromagnetic radiation, which I mentioned in the beginning, things like cell phones and computers. Protein malnutrition. Blood sugar surges, meaning you're eating high doses of carbohydrates. Like a large thing of popcorn at the movies, a soda, lots of pasta, stuff like that. If you do that over and over again, it's going to stress the adrenals. And then people who stay up late watching TV, they don't go to bed early enough. One important thing to know is that the most rejuvenating hours of sleep are the hours before midnight. So if you're one of these people who stays up till 11, 11:30, you're only getting an hour, hour and a half of really, really deep rejuvenating sleep. That's when growth hormone is at its greatest levels, an hour or 2 hours after you fall asleep. So the people who are staying up late and not going to bed early enough, that's very, very stressful to the adrenals. And even people who work the night shifts, that can really throw off your circadian rhythms. Methylxanthines, these are chemicals found in caffeine-containing products, chocolate, tea, guarana. Alcohol is an adrenal stimulant, not good. Leaky gut. Staying in a toxic relationship, very stressful to the system. And trans fats, also known as hydrogenated or partially hydrogenated oils, these are very stressful to the adrenal glands. So the adrenal glands, they sit on top of the kidneys. They're a small gland, and they're basically regulating blood sugar, glucose. They're controlling electrolyte balance in your body, sodium and potassium, you can see on the left. And then they also make hormones, which we'll go over, male hormones, female hormones, sex hormones, and then they make some hormones of their own. There's two of them, one on each kidney. They have a very high blood supply, and then they're also intricately connected with your sympathetic nervous system, with the brain. So there's two ways that the body communicates with the adrenals. One is through your nervous system, and then the other is the brain sending out hormone to the adrenals to tell them what to do. Some of the things you can just kind of look at with yourself or people that you're working with. If the pupil does not react to light, or it doesn't stay constricted when you shine light into it, that can be a sign of adrenal fatigue. Or you'll see it constrict when you shine light into it, but then it dilates right away, or you see it pulses. It's open, close, open, close. That's a sign of adrenal dysfunction. A rough or sandpaper tongue. Dizziness when standing up quickly. That can be from a seated or lying down. Low blood pressure in a non-athlete. Feeling bloated after small meals. That's because the adrenals are required for hydrochloric acid production, and if they're stressed out, it'll shut down stomach acid production, and that's one of the first signs of bloating is one of the first signs of low hydrochloric acid. And then if there's going to be any testing done, that can be done in blood, 24-hour urine, or a saliva test. I like the 24-hour urine. The saliva test is done on 4 different samples over a 12-hour period. Blood is a little bit more inconvenient. You're really only going to get a single snapshot of what the adrenals look like with a blood draw. So to put things in perspective, how do you prioritize healing the adrenal glands? This is a really good visual that shows you where you want to start, what you want to look for. And we're looking at the base trio of ecosystems, the gut, the blood, and the liver. And usually the adrenals will break down secondary to the base trio. And then you'll see the top trio breaks down after the base trio, and after the middle trio break down as well. So when you see adrenal dysfunction, first you want to look to the gut and the ability to detoxify, food sensitivities, gut infections, toxic metals, chronic infections, things like that. Those things need to be fixed if the adrenals are ever going to really recover. Because if you have any issues in the base trio, it's a constant stress to the adrenal glands, and they'll never get well. So you have to pretty much treat them at the same time. And then you also have to look at the middle trio and be treating the other 2 things you see there as well, the thyroid and the pancreas, which is involved in blood sugar. So start with the base trio, start working on blood sugar, looking at the thyroid, and treat the adrenals. You'll see on the top, sex hormones will start to become imbalanced. Neurotransmitters like serotonin and dopamine will become imbalanced. And then the limbic system, heavily involved with emotion. So people who are having, depression, anxiety, mood swings, just going after those directly without addressing the foundational aspects that you see here, you won't really get good results. So this is just a nice way of looking at things. It gives you a clear picture of where to start and how to work your way up. So the adrenals basically have 2 parts. They have the cortex and the medulla. And the cortex is the part of the adrenal gland that responds to hormones from the brain. So you see on the top, the hypothalamus, that's the part of the brain that's just kind of sitting there, and it's always reading what's going on in your body. So if you're thirsty, it's your hypothalamus that reads that and tells you to drink more water. If you have an infection, the hypothalamus picks up on that, stimulates the immune system. So the hypothalamus is also reading how much hormone is circulating or if there's stress on the body. So then it'll send out hormone from the hypothalamus to the pituitary, and then the pituitary releases this hormone, ACTH, which stimulates the adrenal gland. So you have this constant feedback loop with the adrenals, the hypothalamus, and the pituitary in the brain. This feedback system can be heavily disrupted by all the things that we talked about before. And it's not so much the gland itself that is having the issues, it's this feedback system. And when we talk about supplementation, I'll explain why, just giving a bunch of supplements to support the adrenal glands usually doesn't work, because you're not really looking at what's going on in the brain. So cortisol is a hormone made by the adrenal cortex in response to stress. I have a nice slide that shows you the 24-hour rhythm, but its highest levels are in the morning when you wake up, and then it slowly goes down as the day goes on. Cortisol is anti-inflammatory. It converts into cortisone. Many of you have probably heard of cortisone shots or cortisone cream as an anti-inflammatory. Well, your body makes its own anti-inflammatory chemicals, and cortisol is one of them. It will support or suppress the immune system. So again, the adrenals are all about balance. You don't want too much cortisol. You don't want too little. One of the fat storage patterns of someone who has adrenal dysfunction, they'll have a lot of fat stored around the abdomen, around the middle section, and that's a common sign of adrenal imbalance. Cortisol raises blood sugar when you're under stress. It does heavily impact the health of the lining of your intestines. It can shut down digestion by shutting down hydrochloric acid production, and also it will kind of strip blood flow to the intestinal tract for more important things. And then it will break tissue down. So if you're under stress, your body's going to try and produce more blood sugar so that you have more energy available for you immediately to run. But there's a consequence. So cortisol will strip the lining of your gut. It will break off amino acids from the gut to make blood sugar. It'll break down muscle tissue, so you'll lose muscle mass. It'll strip bone, and it'll break down the skin. So too much cortisol, not good. Too little cortisol, not good either, because it is required for many things. It's required for the activation of thyroid hormone. It's required for a healthy gut. It's anti-inflammatory. So it's not a bad thing. It's just bad when there's too much. This is your normal cortisol rhythm. It's amazing how the body, regulates itself in these rhythms. And the highest peak is at 8 a.m. and then, as I said, it goes down as the day goes on. While you're sleeping, your blood sugar levels drop, and it's up to the adrenals and the liver to keep them stable while you sleep. It's one of the first things we look at when someone is having sleep problems, is what's going on with their blood sugar and what's going on with their adrenals. This rhythm can be completely reversed in chronically ill people. So you'll actually see the peak at 8 a.m. is actually at 8 p.m. and you'll see the dip here will actually be in the morning. So these people will be very slow getting started, and then it's very difficult for them to fall asleep at night. So this pattern can be disrupted, completely the opposite of what you see here. The second hormone made by the adrenals is DHEA. This was had a lot of press in the early 90s as an anti-aging hormone. It's also produced in the adrenal cortex, just like cortisol. And the big three with DHEA is immune system function, liver health, and the brain. Those are really the main factors for DHEA. It's involved in what we call anabolic processes, meaning building up. So DHEA helps to build bone. DHEA helps to build muscle. DHEA really helps with mood. It helps with detoxification. And what they found in the literature is that most people with autoimmune diseases like lupus, rheumatoid arthritis, Hashimoto's thyroiditis, these people tend to have very, very low DHEA levels. DHEA is also a precursor to sex hormones, so the testes do not make all of the testosterone in a man, and the ovaries do not make all of the estrogen in a woman. Some of them come from conversion of DHEA into these hormones. So when you're dealing with sex hormone imbalances, you also want to look at the adrenal glands. And DHEA is usually overdosed in many people. 5 milligrams is really the maximum dose that a woman would want to use. Men can go a little bit higher, 10 milligrams. But there are many products out there that have 25, 50 milligrams per capsule, and that's way, way too much. That will cause many, many problems. Some people go and take DHEA just because of what they've read or someone told them to, and it can really screw up their hormonal systems. So the takeaway point with DHEA is you really want to have your levels tested before you would ever want to supplement with it. This is what we call the pregnenolone steal. So all of your adrenal hormones are made from cholesterol, and cholesterol first is converted into pregnenolone in the adrenal cortex. Pregnenolone coming from the word pregnant, so it means really the mother of all hormones. Pregnenolone is then converted into progesterone. It also converts into DHEA, and then DHEA converts into estrogen and testosterone. But when you're under stress, your body will steal a lot of your pregnenolone and make cortisol. So sometimes people who come in, they have signs of low progesterone, or they have signs of low DHEA, estrogen, or testosterone. This is actually a stress response where the body is taking away all of the pregnenolone to make cortisol. So many of the signs of these low hormones, like fatigue and weight gain, low sex drive, DHEA, progesterone, testosterone, all important for the thyroid. So low thyroid symptoms can actually be just a pregnenolone steal, poor gut function, mood swings, you name it. So this is a really important chart to understand. And when you control stress and when you balance the adrenal glands, many times the sex hormones will come back into balance. And this is a common pattern in many, many people. The other part of the adrenal gland is the adrenal medulla. And the adrenal medulla is the one that is under control of your nervous system, more specifically the sympathetic nervous system. The sympathetic nervous system is the so-called fight or flight part of your nervous system. It's the one that is activated when an angry pit bull is running directly towards you. That's your sympathetic nervous system that kicks in. Pupils will dilate so you can see better. Your digestion will shut down because that's not a major priority at that moment. Neither is a good immune system. Your body will then increase blood sugar for fuel so that you can run or fight. Your peripheral blood vessels will dilate so you can feed your muscles to fight or flight. Goosebumps are secondary to sympathetic nervous system activation, and then you'll start sweating, so it's much more difficult for something to grab onto you or hold on to you. So that's your body's natural survival mechanism. And some people are in chronic sympathetic nervous system overdrive, so their digestive systems just aren't working well, their immune systems are poor, and they just don't feel good. The adrenal medulla is where so-called adrenaline is produced, adrenaline and noradrenaline. The chemical names for these are norepinephrine and epinephrine. And these forms of adrenaline are important. Again, it's kind of the same thing as cortisol. You don't want too much, you don't want too little. If you don't have enough adrenaline, then your mood is not really going to be very good, and your energy is not going to be very good. But if you have too much, then you have all these negative effects of a chronic stress response. And then aldosterone is an adrenal hormone. It's made in the cortex. It's not all that talked about very much in functional medicine, but it is an important hormone nevertheless. It regulates blood volume. So basically what it's doing is it's going to cause you to retain water. If your blood volume drops too low, then aldosterone is going to increase it. So it's going to increase sodium absorption in the kidneys, and then it's going to excrete potassium. And one of the ways that you can really stress out your adrenals is to mess with your aldosterone, and that's by just eliminating all salt from your diet, but then drinking massive amounts of water, because this is going to dilute your blood, and then the adrenals are constantly going to have to pump out aldosterone so that you can increase sodium absorption to increase your blood volume. So when you're drinking large amounts of water, I recommend at least a quarter, sometimes half a teaspoon of unrefined Celtic sea salt. Some people like Himalayan salt. That's okay as well. And that works really well if you drink it with water in the morning. So a little bit of salt water in the morning if your adrenals are chronically stressed can really, really help. People who are having extreme sweet cravings or having that afternoon crash of energy, really low levels of blood sugar, hypoglycemia, this salt water trick works really, really well if there's adrenal fatigue. So we were talking about balance, and we want to look at the cortisol to the DHEA ratio. It's important for these to be in rhythm. You can see all the aspects that they're involved in, beginning at the top, muscle and bone health. We talked about osteoporosis as a consequence of poor adrenal function. And then we look to the brain, nervous system tissue, memory and learning, quality of sleep. And then we talked a little bit about, remember the middle trio, you saw the thyroid and the pancreas, talking about blood sugar, and then the other sex hormones. Looking at the bottom, we talked a little bit about fat distribution around the midsection. Very important for protein metabolism. And this mucosal surface integrity, that is indicative of the gut lining as well as the lungs and the sinuses. So people who have gut issues and sinus problems and lung issues like asthma and allergies, you have to look at cortisol and DHEA. Detoxification, too much cortisol will shut down detoxification in the liver. DHEA, however, very important for detoxification. And then what you're looking at here are inflammatory chemicals produced in the body, also known as eicosanoids. These signal the immune system, and people who have adrenal fatigue usually become inflamed, and it's a vicious cycle because the more inflamed you become, the more stress you put on the adrenal glands themselves. And then we have basically the metabolism of sugar and carbohydrates in the system, all related to the adrenals. So as you can see, you have some very, very important things to look at here when someone has an adrenal gland problem. Many of the chronically ill people out there, they have at least 4 or 5 of these things that you see here, and you have to address the adrenal glands. So let's go into some solutions. I like to use what are called adaptogens, and these are basically herbs that Mother Nature has given us. Ashwagandha, also known as Indian ginseng. This works really well to increase energy and to help people sleep. So this is one of the first things I use. Someone comes in and their energy's low and they're having trouble sleeping. We start them on ashwagandha. The other neat thing about ashwagandha is that it enhances the activation of thyroid hormone. Siberian ginseng, first heavily used by Russian Olympic athletes, increases energy, improves mood, improves your ability to utilize oxygen. Works really well with Lyme patients. Panax, also known as Korean ginseng, Eleutherococcus, magnolia and philodendron, rhodiola, and holy basil. So this first group you see here, these are all adaptogens. They all pretty much do the same thing. They all work on the HPA axis. Remember the one we talked about earlier, the hypothalamic pituitary adrenal axis? Helps to normalize that connection between the brain and the adrenal glands. Licorice, not exactly classified as an adaptogen. If someone has very, very low cortisol production, licorice is good to extend the half-life of cortisol. So you're not making very much, but licorice helps what you do have stick around a little bit longer. And then if someone has very, very high adrenaline levels from the medulla, like a lot of norepinephrine, a lot of epinephrine, having trouble sleeping, very wired, very jittery, insomnia, these 4 or 3 work very well for that. Lemon balm, passion flower, and valerian. These tend to work relatively quickly. People usually notice changes right away. Sometimes herbs can take up to 30 days for you to really start seeing them work, but adrenal adaptogens tend to work very quickly. It's really important to balance blood sugar when you're trying to fix the adrenals. These are the nutrients that help to balance blood sugar. Zinc, alpha-lipoic acid, and zinc is rapidly depleted from the body. It doesn't stay in the body very long, especially when you're under stress. Alpha-lipoic acid is actually a prescription in Germany. It's used intravenously for diabetics and diabetics with diabetic neuropathy because it works so well for reestablishing the metabolism of sugar. Gymnema sylvestre, a good herb for blood sugar. Chromium, vanadium, biotin. Vitamin E, make sure it's in the mixed tocopherol format. L-carnitine enhances fat metabolism, and when you enhance fat metabolism, you also enhance blood sugar metabolism. Huckleberry, bilberry, French lilac. The prescription medication for blood sugar called metformin is actually derived from French lilac. It works very, very well to balance blood sugar. So if you're working on all these things, you're eating right, and you're taking adrenal adaptogens, and you're trying to avoid stresses, but you stress your blood sugar systems by eating too many carbohydrates, you're going to set yourself back, and the adrenals really won't be able to come around very well. And then the adrenal diet, very, very important. Number one, you want to have moderate to low carbohydrates. We talked about that with the blood sugar support. Too many carbohydrates, very stressful to the adrenal glands. Second thing you want to look at is food allergies. So you would just take a look at your diet diary and look at what you eat all the time and stop eating it. That's really the best thing to do. You can get tests done to find out what you're allergic to, but really the best success that we have is with just your basic food allergy elimination. You want to look at the foods that you really love, the foods that you really crave, Those are the ones that usually you've developed a sensitivity to. And you're just going to want to eat them in moderation, or what's called a rotation type diet, where you can eat them every 4 days. You just don't eat them every day. But it's good to identify, for example, let's say you have a gluten intolerance and you didn't know it. You could be doing all these other things, and as long as you're eating gluten, it's a constant stress to your adrenal glands. We talked about balancing your water intake with salt. Eating protein frequently and with every meal is one of the best ways to balance your blood sugar. So, I'll have people eat protein with every meal 5 or 6 times a day. Breakfast, lunch, and dinner. Protein with that, and then small snacks in between. And here's just a tip: if you're having trouble sleeping, or you're working with someone who is having trouble sleeping, have them eat some protein as a bedtime snack. So before they go to bed, have them eat it. And this really helps to stabilize blood sugar while they're asleep. See, what happens is sleep is basically a fast. So you have this 8-hour fast, and blood sugar levels start to drop. And if the person is already unhealthy and their adrenals are unhealthy, their liver's unhealthy, it's hard for them to keep their blood sugar levels stable while they're asleep. So what happens is the hypothalamus, the brain says, blood sugar is dropping, we need to survive, we need to get up, we need to eat something. So it wakes you up, and it might even stimulate the sympathetic nervous system to stimulate the adrenal medulla, and then you start pumping out adrenaline. So you'll wake up in the middle of the night and your heart's pounding, or you're really hungry, and you can't go back to sleep. You can't fall asleep. That's because your blood sugar dropped too low. Your adrenals and your liver could not compensate, and now you're pumping out adrenaline, and your brain wants to keep you awake to stabilize your blood sugar. So in that scenario, if you do wake up, just eat some protein, and you should be able to go back to bed. But eating that meal, very small, before you go to bed at night, can really help keep blood sugar levels stable. People who eat a lot of carbohydrates before they go to sleep, that's going to cause a crash in blood sugar, and then they're going to wake up, and the sleep is not going to be good quality. Eat vegetables with every meal to alkalize. Remember, you want a healthy sodium-potassium balance. So the alkaline diet, heavily dosed with vegetables and alkaline-forming foods. Your protein intake should be about 1 gram per kilogram body weight. So you take your body weight, divide it by 2.2, and that gives you your body weight in kilograms. And then you would multiply it times 1, and that would give you your daily protein intake. That's just the minimum. If you're protein deficient, then you would need higher levels, like 1.2 grams per kilogram, 1.5, even as high as 2 grams per kilogram. But that just depends on the person. And then, as I said, avoid excessive carbohydrates, the so-called white foods, breads, pasta, cookies, crackers, soda, candy, etc., etc. All the things that are going to cause these blood sugar surges. Supplementation. Again, this isn't really going to cause any kind of revolutionary changes in someone who has adrenal dysfunction, with the exception of the phosphatidylserine. Pantethine B5 is just heavily utilized in the adrenal gland, as well as some of the B vitamins. Interestingly enough, the adrenals have the highest concentration of vitamin C of any tissue in the body. So if you're under a lot of stress, you'll use up a lot of vitamin C, and vitamin C can really help to support the adrenals. Phosphatidylserine doesn't work on the adrenals directly, kind of like the adaptogens. It works on the brain, and it works by balancing the hypothalamic pituitary adrenal axis. it will work if someone is in adrenal fatigue or if they're in hyperadrenal function. So it'll work for both of them. Works really well in people who are having trouble sleeping or staying asleep. It really helps to balance cortisol levels. It can also come in the form of phosphorylated serine, and that works just as well in my experience. And then magnesium, just an overall calming agent, calms the nervous system, calms the muscular system, really relaxes everything. So these are some things to look at when you're trying to balance adrenals. Some adjunctive therapies, basically these are going to help reduce stress, reduce inflammation, support the brain, chiropractic, acupuncture, and massage. We just know that these work really well for reducing inflammation, enhancing adrenal function, and addressing some of the other issues that you might be having. Neurofeedback works directly on the brain. Somatic therapy, I refer out a lot for this. This is working with the energetic systems of the body, the 7 chakras, helps to identify where unresolved psychological issues or traumas are stored in the body and helps to release them. Because when we have trauma, we tend to store things, unlike animals that just shake it off. And it can be, people can be holding on to these things in certain parts of their body, and that's a constant stress to the system. Good old-fashioned counseling, someone to talk to, helps really well, and then of course exercise. Just a little tip on exercise. Ideally, from a hormonal perspective, you want to exercise when your adrenals are the most active. So that would be anywhere from 8 a.m. until middle of the day. So if you can exercise in the morning or during lunch, that's really the best time from a hormonal perspective. But if you can do a walk at night or something light, you don't want to really do too much exercise at night because you'll stimulate the adrenals and that throws off their natural rhythm. So again, we're under more stress than at any time in our history. Toxins, electromagnetic radiation, poor food, long work hours, you name it. You want to identify the causes of stress, and this can be multifactorial. We went over all the causes in the beginning, but you really want to start with your nutrition, working with a good nutritionist, someone who understands functional medicine, so that they can really figure out where the stress is coming from and correct it. Really, in order to really fix the stress physiology in someone's body, it usually requires more than one modality, so it usually requires multiple modalities. Take time for yourself. A lot of us don't do that. Every time you say yes to something, you say no to something else. So, if you're asked to volunteer or be on this board or that, or if you're one of these people who always says yes, every time you do that, you're saying no to something else that you either love to do or that you should be doing for yourself. Try and do more fun things. Create a healthy sleep environment. Some cases I even recommend turning off all electrical appliances in the bedroom, or even shutting off the breaker for the bedroom, so there's just no electromagnetic radiation in the bedroom while someone's sleeping. Exercise, improve your nutrition, and then supplementation as recommended. All right, so I'd be happy to stick around for questions.
Thank you, Dr. Nick, for a good presentation. We do have a number of questions here, so I will start from the top. In the beginning of the presentation, you were talking about and presented a list of chronic illnesses. Does that include mental illness?
Depression and anxiety, mood swings, those are really the main things that you're looking at when we're just talking about adrenal dysfunction. I'm not aware of things like schizophrenia or bipolar disorder, things like that. If just simple adrenal gland dysfunction is a causative factor in those things. Again, like I said, with almost any chronic disease, you are going to see some kind of dysfunction. As far as if it's a real causative factor of those serious mental illnesses, I don't think that's just the singular cause of those kinds of things, but it can certainly be a factor.
Yes, I agree. In my experience, it definitely can contribute to cognitive impairment and imbalance, but in terms of listing something as a chronic mental illness, I haven't seen it in the literature or experienced it either. So, but a follow-up question here from another participant is, does everyone who have depression issues have an adrenal imbalance?
No, no. You can have depression and not have adrenal dysfunction.
And then, so with that, adrenal dysfunction could contribute to mood swings, both depression and anxiety, but it's not. You're saying it's not specific.
Right. So, someone can have depression, and it may have nothing to do with the adrenal glands. Someone can have depression, and it can be because of the adrenals.
Yeah.
So it just depends on the patient.
Thanks for clarifying that. And then you were talking about a nice list of adaptogenic herbs. And the question is, can they be taken together or in some combination, or should they be taken individually?
That's really just the preference of, who you're working with. Some practitioners really like to use just one single herb, and then some like to use them in combination. And in my experience, they both work equally well. Some people do better just taking one and just focusing on that. Some people do better taking a blend. So, yeah, I mean, feel free to take them in combination or by themselves.
One of the things about taking something individually is you get a sense of what's working and what's not. When you take something in a formula, or you're taking multiple combinations of supplements and herbs, it's hard to know what's working and isn't sometimes. So starting with one at a time and building up into a combination can be beneficial for some people, particularly if they're sensitive and tend to react to some things.
Right, right.
Then this question has to do with bedtime snacks, and it's about a vegetarian protein snack at bedtime. What would you recommend for that? So many of the sources have a lot of fats, and they're thinking that a high-fat snack at bedtime might not be a good idea. What do you think about a high-fat snack and a vegetarian protein source?
It really depends on the person. Beans and lentils, digest very slowly. They're not going to cause any major spikes in blood sugar. So, beans and lentils would be a good vegetarian thing before bed. As far as the fat content, you just have to look at what they're eating in the entire day, and if they've had too much, then you probably want to keep it a little bit low. I'm not really for, really high fat or really low fat, just something in the middle. Other options would be like a vegetarian protein shake from hemp protein or pea. Pea is becoming more and more popular now. It seems to be working well with a lot of people. So a shake could also be used. Those are the things I can think of off the top of my head as far as a strict vegetarian goes.
One of
Vegetables,
the
of course, can be eaten anytime.
sure. One of the recommendations that I give, there's a recipe out of Rebecca Katz's first book, One Bite at a Time, and it's the almond torte. And it's basically ground almonds, eggs, and just a very tiny amount of maple syrup. So there's it's very easy, 20 minutes to bake, and can be carried throughout the day easily with somebody. It can be made into just a torte, or can be made in cupcakes for individual servings. But there you are with if someone's vegetarian that is also eating non-slaughter products like eggs, that might be a good choice for an evening or before bedtime snack.
Yeah, that just nuts just completely slipped my mind for some reason. But yeah, I've had people put like almond butter on those Mary's Gone crackers. That has seemed to work pretty well. If someone's not gluten intolerant, some almond butter on a slice of Ezekiel bread. So you just kind of want something that's going to digest slowly and has a good balance of protein, low carbohydrate.
Good, thanks. That brings me, before I go to the next question from the participants, it brings me back to the concept of carbohydrates. I think that there needs to be clarification. You started your slide with not too much carbohydrates, and then at the very bottom of that slide was specific carbohydrates to avoid. And they were really highly refined, processed, mostly grain-type products and sugar-laden products. But I want to emphasize the value and the broad spectrum that you're also addressing in carbohydrates in vegetables and fruits and whole grains and beans. Those would all be foods that are carbohydrate rich, but that would have a higher nutrient density to them and be more stabilizing to blood sugar, where the more refined processed carbohydrate types of foods, from breads to cookies, etc., would be much more problematic in stabilizing blood sugar.
Exactly.
Okay, so next question. If a person frequently wakens during the night with palpitations and cardiac issues have been ruled out, could difficulty with regulating blood sugar or adrenal fatigue be the issue?
Yeah, that could certainly be the issue. It might not always be the issue, but in some people, that is the problem. The problem is blood sugar, adrenals, and their stress physiology. And they're making too much adrenaline. They can't balance blood sugar, and that can certainly do that. It can definitely affect the heart like that.
Mm-hmm. And staying on this thought of blood sugar, when there's adrenal dysfunction, can it cause high fasting blood sugar, say like over 110 to 120 on a blood test?
Yeah, because chronically high cortisol levels desensitize insulin receptors, so that'll cause insulin resistance, and then blood sugar slowly starts to rise. So definitely.
What about there's a question about how the adrenals work when the thyroid has been removed.
Mm-hmm. Yeah, so the thyroid's been removed. There's no more thyroid hormone, so obviously it's being supplemented with in a prescription format. If you take too much thyroid hormone, that can really make an adrenal dysfunction even worse, especially if you're in adrenal fatigue. So the adrenals definitely need a lot of support if the thyroid has been removed. A lot of people will just get T4 as a prescription, and they need cortisol from the adrenals to activate the thyroid hormone. And then, of course, too much cortisol will shut down that activation. So that's just something to be aware of. It doesn't change, a lot of things as far as how you're working with someone, but you just need to be sure that the adrenals are up and running really well.
Mm-hmm. Back to natural adaptogens. Question about, are there natural adaptogens in food? I mean, the herbs are not, if you had the herbs and you were using them as to cook with at a certain level, but none of them that you mentioned really are cooking.
Yeah, not that I can think of. I mean, Paula, you would probably actually know that better than I would if there's any adaptogenic properties in any foods that we eat. I can't think of any.
Is foods that help stabilize it. So, the foods that you have listed and indicated, I think, will support adrenal health and endocrine health and gut health and blood sugar balance. And but I don't really think of them as adaptogens. An adaptogenic herb brings something back into balance. So if there's low function or hyperfunction, it moves it in that. And stabilizing blood sugar certainly would help with that. So having the right proportion of protein, fat, carbohydrate, and certainly nutrient-dense foods from high-quality sources that are fresh, that would be helpful.
Mm-hmm.
About the stress of a hormonal imbalance from peri and menopause, can that be a contributing factor to adrenal fatigue?
Yeah, that's a really good question. As a woman goes into menopause, the ovaries begin to reduce the amount of progesterone and estrogen that they make, and so there has to be some compensatory mechanisms, and one of them is the adrenals. So the majority of the sex hormones produced in a menopausal woman come from the adrenals and the fatty tissue in her body. So when a woman goes into menopause, a lot of times they'll gain a lot of weight, and that's the body's attempt to create a hormone-producing organ, which fat can be if you have enough of it. And that's going to increase inflammation, and it's really going to stress out the adrenal glands. So yeah, there's a really delicate balance there. The healthier your adrenals are going into menopause, usually the less severe the menopause is going to be. So when you start having, hot flashes and weight gain and mood swings and insomnia and all that, if the adrenals are healthy going in, those symptoms aren't going to be as bad most of the time. If, let's say, a woman, her adrenals are already in fatigue, and then she starts going into menopause, those are usually the women that have the worst symptoms. They're exaggerated, really bad hot flashes, a lot of weight gain, very, very moody, things like that.
Okay, we're getting into some specific protocol questions here. There's a question of how long it usually takes to resolve with treatment, and that's really going to be on an individual situation, but I'll let you address that, Dr. Nick.
Yeah, I mean, I've seen it resolve in 30 days, and then I've seen it never resolve. As an example, someone who's relatively healthy, but they just didn't do things right for a while, and they come in, and then you just kind of remind them of the things they need to do, eating right and exercising and all that. They'll turn around pretty quickly. And then you have on the opposite end of the spectrum a Lyme disease patient, and they're always going to have the infection. So their adrenals are always going to be under stress, and it's I don't want to use the word perfect, but it's very hard to get their adrenals functioning, perfectly working really well, because they always have that chronic stress of the infection. So you have this really broad spectrum of possibilities with people and how long it takes for their adrenals to get well.
Yes, I think it really depends. It started with overall health and how healthy they are, or how long they've been under stress. What their overall health status has been over life. If they've got a strong constitution, genetically, that will make a difference. And certainly the longer that somebody has been ill will require a longer time for them to resolve it. So always coming back to biochemical individuality and the person at hand, and no cookie cutter protocol here. It's really going to depend on the individual.
Yeah, well said.
Do you ever use hydrocortisone to stimulate the adrenals? And if you do, when would something like that be recommended?
I don't. I have used that in the past and never really had good results with it. So it's it's one of those things when you start taking it. Sometimes if you take too much, then it suppresses normal function of the adrenals. The people that I had used it on in the past, it just wasn't really a long-term solution. It's kind of like start using this cream to support your adrenals, and you don't really know how long they're going to have to stay on it, how well it's going to work, how much is it going to suppress their natural function. Some practitioners use it a lot and swear by it. I haven't really used it that much.
Okay, we're going to get into a testing question, assessment questions here in a moment, but this last one, is there anything to take that actually rejuvenates or creates new adrenal cells?
Not that I know of. I mean, the adrenal glands are basically a gland, with tissue in your body, and just the normal nutrition that it needs, the vitamin C, the B5, B complex, some basic vitamins and minerals are required for its function. But as far as the adrenals, when they change in size or rejuvenate, that's really going to be dependent on what's going on in the brain and how they're being communicated with by the hypothalamus, the pituitary, and the sympathetic nervous system. As far as rejuvenating, creating new adrenal cells, I'm not aware of anything that you can take that would actually do that. If there is something out there, I'd like to know about it.
Okay. Do you have a recommendation for just a basic suggestions of breakdown of macronutrients for an individual? You talked about the formula for amount of protein per kilogram for an individual, but if you would say, on average, percent of protein, fat, and carbohydrate in a diet, do you look at it that way, or still on an individual basis?
I look at it on an individual basis. I've always liked the 40-30-30, 40% carb, 30% protein and fat. That seems to give a good balance. But again, it's really variable with each individual.
Yes.
The quality of, you have to look at that 30% fat. You have to look at the quality of that fat, and
quality of all of
the protein and the carbohydrates. I could comfortably say I wouldn't want someone on 80% carbohydrates, and 10-10. I would never do an 80-10-10 or something really high like that. But 40-30-30 would be a good place to start, I would say, generally.
somewhere between 50-25-25 and 40-30-30 is gives you a sense of how a person is going to respond to that, and then adjust the ratio as needed.
Mm-hmm.
So speaking of fats, the next question is about omega-3 and the health benefits that they have on the adrenals. Do you have a comment about the health benefits of omega-3s for the adrenals, or know about omega-3 fatty acids to reduce inflammation and help heal the adrenals?
You know, whenever you're talking about hormones, you have to talk about essential fatty acids because they're required, you know, for hormone production. But I think that omega-3s are causing a lot more problems in a lot of people than good in this day and age. I found many people overdosing on omega-3s, taking high doses of EPA and DHEA, and they cause a lot of imbalances in their fatty acids. The more omega-3s you take, the more you're going to drive down omega-6, and then you get imbalances in omega-9. So if you're going to supplement with that, I almost always use something that has omega-3s, 6s, and 9s in it, because otherwise you're going to cause imbalances.
Mm-hmm.
The only other way around that, you know, and it's just not practical, is to be constantly doing blood testing for fatty acid levels. And that's kind of what drove me in that direction, away from using so many omega-3s, because omega-3s are very fragile, Paula, as you know. I mean, they oxidize very easily. And in a chronically ill person who already has massive amounts of oxidative stress, and you start putting high doses of fragile fatty acids into their system, it's not necessarily the best thing to do. So I recommend, you know, a balanced blend, and you should be getting your omega-3s and healthy fats from your diet. So if your diet is good and you're eating the right nutrition, those should already balance pretty well.
Yeah, I think that would be the first thing, certainly for, you know, Hawthorn students would look at a diet record and see what kind of fats an individual is taking in, and how much of it is saturated, mono and polyunsaturated, and adjust the foods from the diet from there, and then possibly supplement with an omega-3 or a combination, depending on the needs there. So we've got a number of questions left, Dr. Hedberg. How about 5 more minutes? Are you all right with that?
Sounds great.
All right. Do you think it's necessary to have adrenal function tested, or if one suffers from most of the symptoms, can one assume to have adrenal dysfunction?
You can never really make that assumption, because I have seen people who, they seem to have adrenal dysfunction, but when you test them, everything looks really good. That's not the majority of the cases. If you don't have access to lab testing, then yeah, I mean, a good majority of the time, if they're chronically ill, you can assume that they do have some kind of adrenal dysfunction. And an adaptogen is not really going to hurt them. You know, it's usually only going to help them and help them handle stress better anyway.
I think if you look at the symptoms there, and the pattern is there of stress, and it's been prolonged, then certainly you could support the endocrine system and the adrenals with the adaptogens and healthy diet and blood sugar regulation. Yeah. And then in terms of measuring improvement of adrenal function, so how do you measure improvement? And at what point would you measure after initiating the recommended protocol?
Right. I mean, I use lab testing. I prefer the 24-hour urine test. That's a great way to measure. If you're not doing lab testing, then you're looking at the other indicators like blood pressure, slowly coming up. Basically, you're looking at the symptoms related to adrenal dysfunction improving. The pupil constriction,
Mm-hmm.
the tongue, the frequent urination. But really, symptoms are really one of the best ways to look at how their progress is coming along.
Mm-hmm. Mm-hmm.
And if you're doing testing, you want to do that every 90 days.
Mm-hmm. And so you prefer a urine test. There's certainly saliva tests that check cortisol levels. If you're going to do a test, whether saliva or urine, do you think it's important to check levels multiple times?
Yeah, definitely. I mean, the saliva tests that you're going to do are going to be done over a 12-hour period, so you have 4 different samples. The 24-hour urine, you're getting the corticosteroid and DHEA levels over an entire 24-hour period. So again, it's one of those just practitioner preference type things. Some really like the saliva, some really like urine. I don't know that many who use blood exclusively or even use it very much.
Mm-hmm. So we've certainly talked about this, but would you say there's a connection between hypoglycemia, panic attacks, and the adrenal glands?
Oh yeah, definitely. Usually, you'll see low fasting blood sugar, and their adrenals will also be in fatigue or functioning at a very low level.
Mm-hmm.
You'll see that quite a bit, and that can certainly cause panic attacks and anxiety, jittery, very, very hungry, craving sweets, things like that.
Yeah, same thing. So adrenal dysfunction certainly fits into the whole metabolic syndrome pattern then also.
Right, exactly.
Do you follow a typical protocol for adrenal stress? And if so, what would a basic protocol look like? Or do you really look at the individual again and put a diet and supplement and herbal
Yeah, I mean,
recommendations together?
It's an individual thing, but everything that we're doing is in the adrenals. Working on all of that is just
that's the puzzle that you put on a client's presenting issues and needs. I think the same thing. There's a question here about when trauma is the underlying factor, and there's adrenal fatigue. It's whether it's trauma. Trauma is another form of stress. So you'd identify the stress and address adrenal support as needed. But you find that when there's trauma, do you deal with trauma as an underlying issue differently than you would another contributing factor?
I see it as equally as important as everything else. Mm-hmm. And I'm just speaking from my experience with people, but pretty much everyone I see, there is some unresolved psychological component there in their history, and it has to be dealt with in order for them to really get well. So it's a major factor, and it has to be looked at.
Mm-hmm. Coming back to this question about peri and menopause, and would you recommend that women that have hormonal imbalance symptoms from peri and menopause work on strengthening their adrenals and then take adaptogenic herbs to help balance the hormones? I think that in the presentation you were really suggesting that adaptogenic herbs will help the adrenals, which will also overall help hormonal influence.
Right. Yeah, and in addition to the adaptogens, some women they do need some DHEA as a supplement, or sometimes they need pregnenolone, which is another hormone that's available that I talked about as the precursor. So those are kind of two of the hormone therapies, pregnenolone and DHEA. But yeah, I mean, you definitely want to get the adrenals working well if you're going to go to the actual bioidentical hormones like progesterone, estrogen, testosterone. It's just going to work better, and usually the patient doesn't need as much. So if the adrenals are working well, then their prescription is not going to be as hefty, so to speak.
Okay. I'm going to have a few protocol and supplement suggestions, but this question is, this person has to avoid potassium foods in order to fall asleep and wonders what they can do to help the adrenals metabolize or excrete potassium.
What can you do to help excrete potassium?
Mm-hmm.
I mean, the more acidic the foods you eat, the more potassium you're going to excrete. So that's the only thing that I can think of. I mean, if you just when you increase your protein intake, you're going to increase potassium excretion.
Okay, some specifics on supplements. Do you have a recommendation for a type of magnesium that you like and how often to take it?
Yeah, I like magnesium glycinate, and I usually have the patient take it before bed. Just have them do it all before bed.
And for the B complex, the B complex would include B5, but would you recommend that a B complex would be adequate, or taking B5 should be done separately?
You know, since, like I said, you're not going to see really any revolutionary changes just by taking those things, usually the B vitamins that are in the multi that I recommend are enough, and then sometimes I'll use just extra B5, an extra 500 milligrams a day.
Mm-hmm. And a dose recommendation for vitamin C?
Just, you know, your basic dose is 1,000 milligrams 3 times a day.
Mm-hmm. And a source for a good Indian ginseng?
You mean the actual company?
Yeah.
Well, I get it from Moss Nutrition, M-O-S-S,
Mm-hmm.
and they have one that I like called ashwagandha extract.
Mm-hmm. And then the phosphatidylserine dosage, the PS dosage, this person heard that the amount has to be very large and would cause muscle cramps if taken orally, but that Apex has a product that isn't taken orally. Do you know anything about either of these issues? Or
yeah, I've read that, but I use oral and it works fine. And
mm-hmm.
I actually don't use phosphatidylserine. I use phosphorylated serine, and it works
Mm-hmm.
just as well. And that's,
Mm-hmm.
I believe that's about 1,000
mm-hmm. milligrams
at night. If you're going to use phosphatidylserine, then 500 to 1,000 milligrams is a good dose.
Mm-hmm. When there's emotional and psychiatric diagnosis such as ADD and bipolar disorder, traumatic stress disorder, do you find that has an effect on the adrenals?
Yeah, definitely. Like
almost any chronic illness would, right?
Yeah, especially, you know, like they're going to be, those kind of people will usually be heavily medicated, which is going to stress the adrenals right off the bat. And post-traumatic stress disorder just has that constant hyperdrive of the stress physiology. So it's certainly a player.
Mm-hmm. Do you think that adrenal support is something that everyone should consider and take regularly, much like we do a multivitamin?
No, I don't think, I mean, I would never say, you know, everyone should be on one thing. You know, there's people out there that I know that their adrenals are working fine and they don't need to take adrenal adaptogens.
Yeah. I think that if you're looking at someone who is stressed, follow a stress reduction protocol, identify the stress and see how ways to be able to reduce it and support being able to cope with stress certainly is an important factor, but not to assume that even though we're all living on this planet and are faced with a number of different stressors, it doesn't mean that people aren't adapting to that stress. I mean, as humans, that's what our body, you explained very well in the physiology of our endocrine system and the HPA axis. It's what our body does is adapt to stress when we're in health, and when our health declines, we don't do it as well.
Mm-hmm.
So yeah, looking at stress. Have you ever seen that people overcome gluten intolerance when they overcome their adrenal malfunction?
No, I've never seen that happen. If someone's gluten intolerant, you know, their adrenals are going to obviously be out of balance from chronic gluten ingestion. Once their adrenals, you know, come around, that's not going to, you know, correct the gluten intolerance. Mm-hmm. Usually those people are left over with a leaky gut and malabsorption, and that has to be corrected, you know, before the adrenals can maintain balance.
Do you think that children could have adrenal fatigue?
Yeah, especially nowadays. The kids that are overweight and downing, you know, high amounts of soda and sugar and processed carbs, they can certainly burn out their adrenals. Kids who, you know, are like beaten and abused and sexually abused by their parents or family members, they can be in adrenal fatigue at a very young age. Mm-hmm. So mm-hmm. The age, you know, they have age at youth is an advantage as far as their recovery ability, but there are certain things that even a robust living system cannot overcome, and it doesn't matter how old they are.
Mm-hmm. Yeah. This question is about, you know, children that a baby that sleeps in short increments the first year of life, which isn't uncommon. But do you think that's a contributing factor to developing adrenal fatigue?
Definitely, yeah, doing that. And then we also know that if a pregnant mother, if she has adrenal fatigue and she's pregnant, she'll actually draw from the adrenal glands of the baby. So a baby can actually be born with significant adrenal dysfunction.
Yeah, and they could present with blood sugar cravings.
Right.
Also,
yeah.
And need to eat more frequently. Right.
That's, I mean, that's just that's built-in survival mechanism. Biology favors the mother, and, you know, she will take what she needs from the unborn.
So last question here is about, can the adrenals rebound on their own? In other words, if a person suffers from adrenal burnout, can the adrenals repair itself without support other than stress reduction?
Yeah, I mean, if you took someone with adrenal fatigue and you put them somewhere, you know, a paradise island somewhere, and they had no stress at all, and they didn't have to do anything, and they had, you know, great food available for them and all that, yeah, they would come around. But that's just not the reality of, you know, the people in our society. So I haven't seen that happen. That doesn't mean it can't in our society, but sure. Usually by the time they're that wiped out, you know, they're going to need some supplementation. They're going to need some pretty careful dietary analysis, and they're going to need some good support to really get well.
Dr. Nick, this has been a really good presentation. I want to thank you for taking all the extra time to address these questions. You can tell by the number of questions and the interest what an important topic this is. For the people that have been listening, for the people that we work with, it's just for those of us that walk on the planet. So thank you for the comprehensive information.
Thank you again for having me. I really
Absolutely.
appreciate it.
I want to let everybody know that this webinar will be available on the Hawthorn student website under archived webinars. It'll also be under the public Hawthorn website under the free learning section for anybody who is not a Hawthorn student. And you'll be able to review this webinar and many previous webinars, and they'll give you a sense of the variety of subject matter that students learn about while they study at Hawthorn. So I want to thank you all for attending this Hawthorn University webinar and remind you for more information about our programs and courses that Hawthorn offers to visit our website for more details. And if you have additional questions about the programs and courses or enrollment, please give Kathy McDermott, our Director of Admissions, a call. She'd be happy to help you. And I invite you to join us for our next webinar, which is Tuesday, August 23rd, again at 4 p.m. Pacific time. Our presenter will be Professor Heidi Snyder on